Today we'll talk about a frequently overlooked tissue, that's the iliolumbar ligament, coming off of the ilium onto the L5 transverse process, which provides stability. That helps for conditions like a degenerative spondylolisthesis, which typically occur above that site of stability at L4-5. But it may not help conditions like an isthmic spondylolisthesis that happen at L5-S1, maybe because somebody's holding on to the posterior elements all the time. This tissue is frequently irritated, and we call that iliolumbar ligament syndrome or iliac crest pain syndrome because that's where the pain goes. Usually chronic unilateral discomfort, often brought on by some type of lifting, twisting, or trauma. It seems to be provoked by rotation like golf or prolonged sitting. How do we differentiate that from facet problems? Number one, the pain is usually slightly more lateral. And number two, the provocative tests to a facet, like Kemp-Schoeman and Nachlas test, are not as provocative to an iliolumbar ligament. How do we treat it? We can use modalities, we can use spinal manipulation, we give exercises to get rid of the functional deficits that are perpetuating the problem. And one thing that I love is this, an iliolumbar ligament release with a pin and stretch technique. You can see where the ligament lives in this picture. You see Dr. Steele applying a pressure. The patient's bringing their knee towards their chest as he's stripping over the top of that ligament, helping to release adhesions, get some blood flowing to the area, and relax the tissues. Hope that this helps in your practice. Thanks for watching. We'll see you next time.